I tell you as a basic thing in the last phase. The basic thing is that when you are answering your practicals, first condition is don't get nervous. This is one thing. Once you get nervous, you start falling. ঠিক আছে? What are the bones? What the total human skeleton? Your head, neck, your upper limb, lower limb, your vertebrae, cervical, thoracic, and your lumbar, pelvis as a whole, sacrum, and your innominate bone. Innominate bone, you know? Innominate. Dakho, Google Baba. Innominate bone. Innominate means irregular. You see, this bone has an irregular shape. Innominate. Okay. Now, this is a shaft, long bone described. It has an upper end and lower end, and your shaft. The both ends, they are articulating with some bone. The lower end of femur articulates with the upper end of tibia. This is one thing. Second thing, your upper limb, lower limb are more or less similar in function also. Like a great toe can be transplanted in the thumb. If there is loss, then great toe can be taken as a graft and put in. But that prehensile catching, holding, that can be easily done. And that's a batch of the surgeons will work for 36 hours and your tendon, sutures, everything to align the limb with the great toe of the thumb to, in place of the thumb. So, vertebra especially. 3 vertebra, cervical is called the A. 3 vertebra, first, second, third. You have to know. What is the foramina? If you are answering well, vertebral foramen. Now, that supplies the brain. Any question can be asked by the examiner. This thing, your thoracic vertebra, it will have costal facets. Lumbar vertebra does not have costal facets. And it is robust. It is more, because if you see the spine, the line of gravity, it goes then from symphysis pubis up to the ankle joint and into the great this thing. So, these are the things, soft tissue parts, your stomach, liver, spleen, uterus, kidney. So, what are the organs? The right kidney, left kidney, ureters, your constrictions of the ureter. It's important. In Viva, it is important because you will ask, and it has an importance of, if you say renal colic, it has an ascending pyelitis. Ascending means it is going, the ureter, there's infection. and also the stones get lodged in these constrictions. This is the stomach, greater curvature, lateral curvature, this is the body, this is the fundus. Itna bolo kafi hai. But you have to identify. And don't feel nervous. This is the key.